Now, speaking of sleep, it can be tough for some people to get a good night's rest, including expectant moms. They pose some unexpected issues there. We've got Dr. Joseph Ogile here from the Clayton Sleep Institute with the other changes that happen during pregnancy that many moms-to-be may not know about. So we were just kind of talking about some different ones here, and one of those is changes in sleep patterns. So what are some of the things that moms, may or may not know about when they're newly expecting?
Part of it is just normal physiology. So when we're waking up from our naps now, I guess, is the normal physiology. Mom's blood flow, their volume of blood in their body can increase by up to 50% due to the pregnancy. So they tend to have to get up at night to go to the bathroom more than they did before. That's normal, but it's disruptive to sleep. So part of it is giving them a sense of awareness, drinking plenty of fluids during the day, but maybe trimming back a little bit on fluids just before bedtime. One of the things that a lot of moms know about is using pillows. Pillows are basically your friend during pregnancy. So between the legs, helping on when you're side sleeping. As you get further into pregnancy, more side sleeping and things like that. The other exciting things going on with pregnancy and sleep now is there's more and more data and studies. Initially, for several years, there were studies suggesting that moms who snored, their outcomes weren't quite as good.
Really?
Now there's increasing data to suggest that snoring is really moms developing obstructive sleep apnea or who had obstructive sleep apnea non-diagnosed before the pregnancy, which is getting worse. Again, due to the same thing, the increased blood volume, increasing swelling in the back of the throat, that actually puts moms at higher risk for gestational diabetes and hypertension. Consequently, that can affect the baby.
I was going to say, so if you start to notice things like that, especially if you didn't have those before you were pregnant, what types of things should you be doing?
That's something, if you or your spouse notice that, you need to talk to your doctor. First, they want to have that conversation, whether it's your obstetrician or your primary care doctor, and we can treat that. And some moms just need treatment while they're pregnant, so we can put them on an auto-adjusting breathing machine that helps them at night, or they may need it long-term. We've had, for instance, we have one mother who had such severe sleep apnea before her pregnancy that she actually miscarried. We treated her, and now she's successfully carried a baby who's a year old now. So we're excited about that.
Yeah, I was going to say, so it could be an issue causing other issues that you really just knew nothing about.
Yeah, it can. It actually, about 40% of women who get sleep apnea are at risk to develop preeclampsia, which is the syndrome of swelling and high blood pressure.
All right, and another thing too, I know with women who are pregnant, you're carrying around all that extra weight. You're going to get tired. That's something we all know too much about. Frequent napping. When is it normal? When is it something where you just know that you just need to really, you're lacking on sleep?
Yeah, I would encourage moms, pregnant women, moms to be, so to speak, napping is going to be a good thing for them. They're going to have disrupted sleep anyway. And I think scheduling a nap if they can, if the mom is working, scheduling the nap either right after they get home from work, 30 minutes to an hour, or if they have a workplace that will allow them to rest a bit, that's going to be a really good thing. And moms may need 2 naps a day too.
All right, and then this is the one they always say, sleep after the baby is born, sleep when the baby sleeps. But I have talked to enough moms, both of my sisters have had kids, they say that is impossible. So what are your suggestions for those moms who are getting up at all hours of the night, only sleeping about 2 hours at a time? What do you do there?
Good luck. I mean, that is,
Oh, no.
It's a very difficult time. You have to have a team approach, a structured approach to when you're going to get to sleep. You really need help. You need, your partner in crime, so to speak, your partner with that child to help you get enough sleep. You do need to use napping. Sometimes you have to get someone actually to come and watch the baby for several hours just so you can get some sleep. That first 3 to 6 months is very difficult.
So this is when you don't turn down help, accept it all the time, and napping really can be a good thing.
It can be a good thing. You've got to get through that period. And yes, help is good. If you can get someone to come in and watch the baby for several hours to get some solid, uninterrupted sleep, please do.
Those sound like some really great tips.
Thank you.
Dr. Joseph Ogile, thanks so much for joining us here this morning.